Welcome to the podcast where we discuss health, health span, lifespan, and longevity. I'm Dr. Noor Gajraj. Okay, then. Well, welcome to the podcast. Today we've got Dr. Joe again. He is a functional medicine doctor practicing in New Orleans, and he is dedicating himself to treating patients that haven't been treated satisfactorily before. And we're going to talk today about heavy metals. We do need heavy metals such as iron and zinc.
Yeah.
Too much accumulation of other heavy metals can be toxic. Lead, mercury, arsenic, cadmium, thallium, uranium. And when you're seeing patients with symptoms such as fatigue, weakness, joint pain, muscle pain, headaches, GI issues, neurological symptoms like numbness, tingling, or tremors, or anemia, it might be heavy metal toxicity. So, thank you again, Dr. Joe, for talking about this. I don't really know a lot about it. I suspect that it's the cause of a lot of symptoms that haven't been pinpointed yet. So tell us some of your experiences with heavy
Yeah,
metal
it's
toxicity.
a fascinating topic because we're always trying to sort through when you have a patient come to your clinic and they're not well, you're always asking, okay, what am I missing? I've done the basics and they're still ill. And I had the opportunity to talk to you a lot about the GI issues I see and then mold illness. So those are two very, very common pieces that make people ill, but sometimes it's not mold.
Yeah,
Sometimes it's not the gut.
right.
Sometimes it's heavy metals. And so the place to start in my mind is separating acute toxicity where levels are high enough to drive symptoms, and that's quite rare
Hmm.
as compared to the epidemic of low-level exposure that we're seeing in our country.
Right.
And that is more of the reality that most patients come in with is this low level of exposure. And that's driving cardiovascular disease and metabolic disease in the background. It's not, your mercury level is, 2.5 and your blood lead level is 2. You're not acutely sick, but you are an inflammatory mess. And we know that that is increasing our risk of cardiac disease, stroke, dementia, right? So I look at these low levels more of an opportunity for preventing problems, for optimizing lifespan and health span. And I think we want to look at it through those two different lenses. And I think we'll be able to talk about both acute illness and the chronic exposure.
So tell me, how do you test for it? I mean, symptoms, signs, and how do you test for it?
Well, I test with blood, a simple blood draw. This can be done at any major lab, and that generally gets you mercury, lead, arsenic, and cadmium. And for my purposes, lead, mercury, and cadmium are the three that you really can hang your hat on with a blood level.
Mhm.
Arsenic is not accurate in the blood, and so even though it's reported by all the labs, you really can kind of ignore that.
Mhm.
You want to get some heavy metals by urine. So alongside a blood draw, I'm asking them to do a random heavy metal urine test. I use the lab doctor's data. I've used them for a long time. They're very good at this. The kits are inexpensive, less than $100. It doesn't take a long collection time. I don't like getting the 20, have them, hold the jug of urine in their fridge all day long. You just wake up and do a first morning void because we're trying to ask the question, where are you? It's a snapshot. What does kind of a daily, regular day look like? What does the excretion look like? So specific metals you can really only see in the urine that we don't have the opportunity to check in the blood. So if you only check the blood, you're going to miss accurate arsenic levels.
Mhm.
You're going to miss cesium.
Mhm.
You are going to miss thallium and uranium.
Mhm.
Thallium and uranium, they sound scary because they're radioactive heavy metals. Over the last year in particular, I'm seeing more and more of this in my samples in a way that I didn't see before in my patients. And so I'm a little bit worried about some of the environmental aspects that may be driving the thallium and uranium up. And, I was speaking to the Louisiana State Department of Health last week, right? And it's not even on their radar. They know about mercury, right? So they'll call if you send a blood mercury above 10, they'll call, which is great, but they're behind on some of these other metals that are causing illness.
Good. And so, what do you commonly see then in terms of those four main ones? Which ones are usually the most problem?
Lead is by far the most common at low levels, and I think lead is the best metal to use as a descriptive tool for some of the problems that we can have because we have really amazing public health data in this country. Well, we have had, I don't know that we still will moving forward, but we've had amazing public health data where we have this system called NHANES, and they have been doing questionnaires and urine and blood samples of US adults from back as far as the 60s. And I think since 1988, we've had these consecutive ongoing samples where you can say how much lead is in the average American's blood, how much mercury, how much arsenic.
Hmm.
And using that data, we can really start to understand what the risk is looking like for low levels of lead. And would you like me to touch a little bit more on that, or just
Yeah,
focus
definitely.
focus back out on some of, mercury is also an issue, but
No, no, let's stick with lead. I see that it's found in old paint, contaminated soil, some
yep.
pipes. It can cause CNS damage, kidneys, reproductive system, and of course, in children, it can lead to developmental and behavioral problems. So yes.
Yes. And the key thing that I'd like people to know about lead is that we used to have the idea that it can only cause problems, at 5 micrograms per deciliter or above. That was kind of the cutoff. Then every single time we take a deeper look at the public health data, the lower this level drops. So a lot of the old scientific research of how much harm is using that cutoff.
Yeah.
But when you zoom in and you say, okay, is there harm at levels below that? The answer is absolutely yes. So there are about 225 to 2.3 million deaths in the US. And if you look at blood lead levels below 5, we think that about 400,000 can be attributed to lead,
Mm.
particularly cardiovascular disease, heart attacks, and strokes. And this estimate is about 10 times higher than we used to previously think when we are now acknowledging that low levels of lead can cause illness. And it's such an order of magnitude, it's such a big epidemic that we think that the public health community thinks that low levels of lead are actually causing more mortality than cigarette smoking
Mm.
because 20% of the US population smokes. And even though, uh, cigarette smoking is a bit more harmful than lead, so many more people are exposed to these low levels of lead that it's causing a larger amount of damage. So
Okay.
it's really, really sobering to know that these low levels, and they're levels that I see in my patients all the time. We're talking about blood lead levels of a little bit higher than 2, are where when we really start to see this cardiovascular risk magnify.
So if you do find a raised lead, what is your treatment strategy?
Well, the first rule of toxicology is stop being poisoned.
Right.
So you
Yep.
find out where it's coming from.
Hmm.
And lead paint has gotten, I think, is pretty square in people's minds as an issue.
Right.
Lead pipes and aging infrastructure, I think, has gotten its due from Flint, Michigan. Um, I see other sources in my patients. I see people living near highways.
Hmm.
And I think that they are being exposed from air pollution, not just the particulate matter, the combustibles, the VOCs, and the diesel components, but they're getting inhalation of lead. And scarily, I am seeing it in really common foods, even things that we have thought were safe. And the one I'm seeing the most is chocolate,
Oh,
right? And
bad
so, you
news.
ready? So, I'm so sorry for everyone. You can't unhear what I'm about to say, but we always say, okay, dark chocolate has, right, more polyphenols, more antioxidants. So if you're going to eat chocolate, eat the darker chocolate.
Right.
It's more concentrated cacao, and that means higher levels of lead. They're being contaminated with how it's grown and how it's processed. The
Mm.
darker the chocolate, the more lead we're finding.
Wow.
And so, in particular, If you can look up, and this is pretty well shown on the internet in Consumer Reports, Trader Joe's dark chocolate is one of the highest in
Wow.
lead and cadmium, and it's just devastatingly high. I had a patient who came in and his blood level was just persistently elevated, and we're doing detox. And I'm saying, okay, well, it should be coming down. It's not coming down, and kind of went in, and after a little while, he's like, "Well, doc, I didn't really tell you about the Hershey Kisses."
Wow. Yeah.
And so throughout the day, he's just popping Hershey Kisses, right? So that's a major source of hidden lead, chocolate. Another is plant-based protein powders. People
Mhm.
are wanting to go, more organic. They want alternate protein sources, and so they're using hemp protein and pea protein, rice proteins, and I've got a case report of patients just with elevated heavy metal levels as a direct result from the protein powders. So we really need to start being careful and start looking at things um, a little bit more skeptically, and not assuming things are safe just because it has an organic or gluten-free label on it.
So definitely avoid exposure in the first place. When do you move to chelation therapy?
Chelation, in my mind, is IV treatment.
Right.
And I don't do IV treatment because it's not needed in the patients that I see.
Right.
I'm not seeing blood lead levels of 50.
Hmm.
Right? The max I believe I've seen in my clinic is 20. We found the source and used an oral protocol to bring that down. And so that was just fine with me. But, had that patient not been successful at bringing it down in a quick place, then I would find an IV center really set up for that. That's a very specialty part of medicine. It's not common and there's a lot of risk. And so what we don't want to do is say, oh my goodness, my blood lead level is 5. I need to run to an IV therapy
Hmm.
because we don't have as much safety information on when we should chelate low levels. And some of the emerging TACT2 trials suggest that IV chelation, even though we thought might help with diabetes and heart disease, when the TACT1 trial showed some benefit, when the TACT2 came out, it looks like maybe we didn't get that benefit from IV. So I'm a proponent of oral treatment. And so when I'm treating heavy metals, you take away the source,
Hmm.
and then I'm using probiotics twice daily
Right.
and a supplement that I formulated that has a number of binding agents in it called ProBind Select from Moss Nutrition.
Right.
And I formulated that because we know that charcoal and clay and chlorella and certain probiotics bind to heavy metals and mycotoxins and plastics and endotoxins. But I was tired of asking my patients to go take a bottle of chlorella and a bottle of clay and a bottle of charcoal and just swallow all these pills. And so
Right.
I have them use ProBind and can find that we get good level reduction from heavy metals.
Good. All right. So let's talk about mercury. So that's primarily from industrial pollution and consuming contaminated fish. It's a potent neurotoxin that can cause neurological disorders, kidney damage, and developmental problems in fetuses and children. So, what's your experience with mercury?
Well, yeah, and I would also add there's tons of clinical literature showing mercury levels are associated with development of the most common autoimmune disease,
Right.
Hashimoto's thyroiditis. And
Oh,
so for that reason, we really want to be aware of the problem that mercury can have. I see this most from fish consumption. There are different types of mercury,
mhm.
organic and inorganic mercuries. And the types of mercury that you're going to find in the blood, 95% of this is coming from contaminated seafood,
Right.
fish, sushi, tuna, and that's commonly what I see. And so if I can have people drop their fish consumption and then use ProBind Select, I find the levels come down quite quickly, quite nicely. Urinary mercury is more of a mix, but that tends to come from other sources. That's when I start to worry about the patients who have large amounts of silver mercury amalgams and who might have had mercury exposure from other sources.
Excellent. So, the same approach, decrease exposure and your oral regimen?
Yeah, mercury's a little bit different though. So always when I'm using a detoxification program, I'm using probiotics morning and night and Probind in the middle of the day. But when mercury, I think there are some pieces here that are additionally helpful. So
Mhm.
the nutrient selenium is very helpful specifically for mercury detoxification.
Mhm.
And if these patients they have elevated mercury levels, they've run through all their selenium stores. And so for these patients, as long as they're on detoxification with me, I'm giving them extra selenium, right? Just
Mhm.
to make sure that we have all that we need to detoxify. I
Right.
also find for patients who let's say so generally I'll get a 50% reduction. We reduce the source, we use the oral detoxification program, and I'll generally see a 50% reduction in 3 months.
Mhm.
The general rule, a little more, a little less, but sometimes patients will come in and we won't quite get that. And that's when I would start to say, okay, maybe we need a little bit of N-acetylcysteine, right? Do we need the precursor for glutathione, an antioxidant in its own right? Maybe we need glutathione,
Mhm.
right? And I don't remember, Nor, if we talked about how I hate glutathione for mold toxicity because it crashes people, makes them
Right.
sick as shit, right? A
Right.
single dose knocks them out.
Mm.
Metal is different. If someone comes in and they just have metal and they've done well with the oral detoxification program, I think they're a candidate for glutathione, and
Mm.
we can consider adding that to speed things up. That's a case by case basis. It's not for everybody. It's not needed, right, for everybody, but that's one that I would definitely consider.
Okay. And then arsenic. It's found in contaminated groundwater, pesticides, some
Yep.
industrial processes.
Yeah.
Chronic
Here,
exposure,
here in
yeah, can cause skin lesions,
Here in
cardiovascular.
Southeast Louisiana, rice.
Yeah.
Rice is can be contaminated, and probably the same with y'all in Texas. Rinsing rice before you cook it, I think, is pretty important. That's a big source. I've seen it from treated plywood.
Oh,
It can be a component there. So one guy was making a deck, right? Cutting up all that wood,
yeah,
and he had quite high arsenic levels. I think about that as well for contractors, people
right.
renovating their home.
Mm. Anything different in terms of treatment?
No, arsenic seems to be excreted pretty quickly, pretty elegantly, and that one seems to be one of the easier ones to
Mm.
clear and get rid of.
Cadmium is released from industrial pollution and cigarette smoke can
Big
cause,
time for cigarettes,
yeah,
absolutely. See
problems
that
in the
quite often.
kidneys, bones, leading to kidney failure and bone disease. So, what's your experience with that being?
Well, yeah, so cadmium, as soon as you see that, I think most of us in medicine are saying how many cigarettes are coming in a day.
Mhm.
But there are other things that can do this as well. So there were so I already said mean things about chocolate, right? So
Mhm.
well, let's say mean things about kale.
Right.
Okay. Kale is a brassica vegetable and it just soaks up water, just soaks it up, loves it.
Mhm.
And with that, it really can bioaccumulate heavy metals, particularly cadmium. So there was a really neat study, and this was done in Turkey, in Istanbul, Turkey. And they looked at different vegetable gardens and they said, how close were they to major highways? And of course, the kale, it was kale and what else was it? It was arugula and kale that was grown
Yeah.
closer to the highways, had higher concentrations of lead and cadmium and mercury than those grown away. So, sometimes this is simply a vegetable problem, right? How many times does your doctor say stop eating, green leafy vegetables and kale? But
Mhm.
I'll tell you, Nor, I've had several patients come in and their metal toxicity was a direct result of them doing green smoothies.
Oh, okay.
Kale and spinach and greens powder, how many, like 5 or 6 servings, right, in a blender. And you'll see this with the patients who are on the multiple sclerosis protocol from Terry Walls.
Mm.
Because Dr. Walls is a big fan of like all these green leafies, and she says like eat like 10 servings a day,
Mm.
and they're just packing in the metals.
Uh,
So we just need to,
yeah,
medicine is about balance, right?
yeah, definitely. Say a few things about thallium and uranium then, because they're not well known at all.
No, they're not. And when I started seeing this, I had a hard time too because there really is not much published apart from the realm of Russian poisonings.
Right, right.
Okay, but we can learn something interesting from that because the poisoning victims you'll see who are poisoned tend to lose their hair. And I found that that's one of the hallmarks of thallium and uranium can be hair loss. Pretty interesting. This is how it first came on my radar. I had a patient who thinning hair, and she was the one with the green smoothies,
Mm.
right? So when we pulled back on all the heavy metal contaminated um, green smoothies, hair grew back. And so thallium in particular is one. If you have a patient with hair loss, it's not getting better as you optimize the protein, right? As you give them the extra nutrients, extra folates, extra B vitamins, Nutrafol. It works. It's a over-the-counter supplement most people are familiar with. That works. But if you're doing that and you're working on the stress and the sleep and the gut and the hair is not back, I would definitely look for thallium. I've seen this a few times. And in a couple of those cases, hair came back. One of my patients I've been working with for a long time is a young man, 38-year-old, but he came in to work with me, and he had alopecia uh, totalis, just all gone. And so I didn't know this at first because he had tattoos
Right.
to kind of pigment the
Yeah,
scalp to kind of give him like a little
yeah,
grown look.
yeah.
But it turns out he had one of the higher thallium levels. And so in my mind, I was wondering how long had that been in there? Was that perhaps a contributing factor when he developed alopecia all of those years ago? So that I think that's quite important to just keep on our mind.
Yes. So it occurs to me then that we're probably missing a lot of these cases because there's a lot of patients that come in with symptoms that could be heavy metals, fatigue, weakness, joint pain, muscle pain,
Yes.
headache, memory loss, GI issues, neurological symptoms, anemia. So, I mean, it's a very simple thing to do if you haven't got to the bottom of the symptoms, send
Yeah.
off a blood
This,
and a urine
yes, this
test, right?
is people in my world get far too much functional medicine testing. They come in and they've wasted thousands of dollars. This is a no-brainer. Every single adult over age 50, get a one-time blood draw and pee in a cup one time. What is your baseline? Where are you? Because you won't know if you don't find it. And this is an inexpensive test with a result that can be easily treated, found, and mitigated so you can live longer and not have cardiovascular disease. We spend all this time, worrying about insulin and blood sugar and LDL, right? Metals are being missed all the time, and particularly arsenic, thallium, uranium are being missed all the time because people are not doing the urine test. You don't find them in the blood, and if you don't look, you won't find them. So I'm really glad you gave me the opportunity to get on my soapbox
Yeah.
about that.
No, I think that's I think it could really help patients if this was looked for, and I agree we're missing them. So I've got just a couple of obviously simple things. We have to be aware of the issue before we can get to the bottom of it, right? So
Yeah.
I think awareness, obviously, avoiding contaminated sources, washing your hands after working in the soil. So, is there anything else we should add? I think that covered it very well.
Yeah.
Something very easy to test for.
Well, since it's been on my radar, I've been collecting cases in a way. Where are these being missed? And I'll just give you a couple of the things I've found to be the source because it's hard to figure out where the hell is this coming from.
Mhm.
And there's lots of variables, but I'll just run through some of them, maybe some of the more interesting ones. Number one is vaping, right? So people will give the cigarettes aside and then they'll start vaping and they'll say, well, it's an organic oil and blah, blah, blah. It's the coil. As the coil is burning, it's releasing metals into the oil, and people are breathing that in directly. Vaping is a big source, and I think as vaping is on the rise, that's contributing. The disposable coffee pods have
Mm.
been found to have high
Wow.
levels of metals in them, even the plastic Keurig cups, right?
Wow.
And there are lots of people who just
Yeah.
all throughout the day
Right.
drink,
Yeah.
making them throughout the day. I mentioned the chocolate and the plant-based protein powders. I've also seen artists oil and oil-based paints. That can be one. I've seen potters who are glazing pots and having high levels. COVID, people started making backyard gardens,
Yeah,
growing all of their vegetables. And here in New Orleans, there are areas of our soil that is really heavily contaminated with lead.
right,
And so, one of the highest levels, this was a man who was sent to me with suicidal depression, treatment resistant. He'd been on 5 medications from the best psychiatrist in the city, nothing, just
right.
horrible depression. And it was the lead. It was the lead level that was coming in. I don't remember the exact number, but it was well above 10.
Hmm.
A month into the binders and the probiotics, everything got 50% better. The suicidality went away. And then by about 3 months, he was 80% better, right? Not being exposed and getting it out slowly and steadily. I think thallium and uranium are coming into our food and water supply as a byproduct of fracking. The
Uh,
produced water, they're injecting the water into the layers of the earth
yeah,
to get the natural gas out. And I believe that that water is being contaminated with heavy metals as a byproduct. And in places like California, where there is a drought and not enough water,
yeah,
they use that water.
right.
So sprinkling on the avocados and the dates, and I'm just worried about, are we poisoning ourselves and we're not even checking the levels? No one is aware. The states aren't monitoring this. We are just watering ourselves with heavy metal contaminated um, with radioactive elements. I do worry about that, particularly because it doesn't seem like this is commonly known.
Absolutely. Well, I'm very excited. I'm going to be looking for these cases. I'm ashamed to say I've never tested for it, so I'm probably missing, and I'm excited to try and spot some of these problems and give them some long-awaited relief. So thanks a lot. We've come to the top of the hour or the bottom of the hour, so thanks very much. I appreciate it very much.
Wonderful. And thank you so much for having me again.
Thank you. Please subscribe to my channel and read my new book, 100 Pathways to Longevity. Add 25 years to your life, available on Amazon.